I want to thank everyone for inviting me to speak today. My presentation is on airway remodeling in ferrets with cigarette smoke-induced COPD using micro-CT imaging. Chronic obstructive pulmonary disease is a leading cause of death in the US. Millions suffer from the chronic bronchitis phenotype of COPD, largely due to cigarette smoking. Data from our lab and others indicate that cigarette smoke can lead to cystic fibrosis, transmembrane conductance regulator dysfunction, enhanced mucus production, and impaired mucociliary clearance. To overcome the limitations of the mouse models in recapitulating CFTR-related human pathology, we recently developed a ferret model of COPD to investigate the clinical significance of acquired CFTR dysfunction associated with features of chronic bronchitis, including delayed mucociliary clearance, goblet cell hyperplasia, and epithelial hypertrophy, and increased airway resistance. Chronic airway inflammation, epithelial hypertrophy, and mucus hypersecretion are known to cause increased bronchial wall thickness, which underlies airway disease in COPD patients. Here we investigate the presence and severity of airway remodeling in smoke-exposed ferrets using in vivo high-resolution CT imaging. We use age and sex-matched wild-type ferrets and expose them to diluted mainstream cigarette smoke for 6 months using an automated cigarette smoking apparatus. The ferrets are then CT'd using a MILabs CT machine under inhaled isoflurane and at ultra focus magnification and gated for respiratory gating. We then reconstruct the images at 40 to 80 voxel and filter them at 0.5 millimeter Gaussian smooth using PMOD software. And here I'm going to show a video of the ferrets being exposed to cigarette smoke in their nose-only tubes, just to see how they enjoy the experiment. Our previous work has shown that smoke-exposed ferrets exhibit goblet cell hyperplasia and mucus impactation. And on the top, you can see histological images of air control in smoke-exposed ferrets. You can see how the epithelial height is significantly increased in smoke-exposed ferrets versus air control. And the goblet cell area versus luminal area is also increased in smoke-exposed ferrets. You can also see in the last figure how this trend continues with the airway size and of the ferrets. I then wanted to determine how the airways were being affected by cigarette smoke by using measurements. I did this manually in 3 locations, apical, medial, caudal, and in the left and right lungs. And I took measurements at each of those locations, the luminal diameter, which is the yellow line in the right image, and then the bronchial wall thickness, which is the red line in the right image. And I took an average of those measurements per ferret and plotted those and found that the bronchial wall thickness significantly increased compared to the air control. And the luminal diameter also increased in the smoke-exposed ferrets, which then the thickness diameter ratio was also seen to be significantly increased in the smoke-exposed ferrets. I then wanted to find what was the determinants of the bronchial wall thickness. In order to do that, I took all of the measures of if they were smoke exposed, anatomical location, sex, and laterality, and found that the main determinants of the bronchial wall thickness was the smoking status and the anatomical locations of the ferrets. We then wanted to devise a semi-automated measures so that we wouldn't have to manually measure airways and to make measurements more reproducible. To do this, we would take an airway segmentation and orient it so that the airways were in a vertical position to make more accurate measurements. And we also wanted to use a PI measurements, and this is going to be in our manual measures, where multiple measurements of the relationship between the airway perimeter and bronchial wall area are determined on an individual basis and then calculated for theoretical airway with a luminal circumference. And for humans, this is of 10 millimeters. And this was devised to avoid bias due to between subject differences in airway sizes, which is then used as a technique to improve the understanding of COPD progression in patients, which is seen to worsen with chronic bronchitis and airway disease. So in this figure, I wanted to take representative regression dot plot of airway perimeter of smoke exposed ferret and control ferrets and square root of wall area, and found that the slopes were statistically significant and the smoke exposed ferrets were more affected. The square root of wall area was increased. I wanted to also find the average of the probability density of the luminal perimeter sizes in the control ferret, and found that 65% of the airways fell between 1.5 and 2.5 millimeter luminal diameter, to which we used 2 millimeters as an average. And then on plot C, I wanted to plot the manual regression lines of an air control at 2 millimeter perimeter, and found that the square root wall area was around 1.2. And with D, I plotted the smoke exposed ferrets at 2 millimeter luminal perimeter and found that the average of the square root wall area was around 1.5, to which you can see in E that the smoke exposed ferrets had a significantly increased square root wall area at PI2 versus the air control ferrets. So semi-automated analysis of the airway wall anatomy in the ferrets, we saw similar findings as what we did with the manuals. We used more measurements. We used about 200 measurements per airway with the semi-automated analysis, and found that the bronchial wall thickness was increased in the smoke exposed. We also found that the probability density, that the average of the luminal perimeter was about 4 millimeters. And this was due to the fact that the semi-automated analysis couldn't go as far down in the airway tree as a manual selection. So at the scatter plot, we also saw that the smoke exposed ferrets slope were significantly different from the air controls. And we saw that the air control square root wall area was about 1.8 millimeters at a luminal perimeter of 4, and that the smoke exposed was about 1.9 at a luminal perimeter of 4, to which was significantly increased in the smoke exposed ferrets. We then wanted to look longitudinally over time in a small group of ferrets. About 3 ferrets were CT'd from 0 to 6 months. And in A, this is the manual bronchial wall thickness measurements, and we started seeing a significant increase in bronchial wall thickness at about 2 months, with 3 and 4 months being around the most severe increase in bronchial wall thickness, with it starting to level out. In B, we wanted to show the same thing in the semi-automated measures and found that you can see this significant increase in smoke-exposed ferrets at 5 and 6 months. We then wanted to show that using the PI4 measurements that you can determine the airway remodeling even as soon as 3 months in a semi-automated analysis. And in the graph D, these are D and E are control ferrets over time, just to show that control ferrets don't differ in their bronchial wall thickness over time. And we found in D with the manual measurements that they're pretty steady over time as they age. And in E, this is the semi-automated bronchial wall thickness, again, pretty level over time. So in conclusion, measurements using micro-CT imaging demonstrate increased bronchial wall thickening, which is compatible with airway epithelial hypertrophy, mucus overproduction accumulation, and airway remodeling. These features are consistent with clinical observations in patients with chronic bronchitis. In summary, we successfully developed CT-based metrics of airway disease in a COPD ferret model, allowing within and between subject comparisons in vivo, enabling longitudinal studies as pathology evolves. Micro-CT imaging further validates that our COPD ferrets are highly representative of smoke-related chronic bronchitis in humans and are a useful model to evaluate disease mechanisms and therapeutic interventions. I want to thank you again for having me, and I would like to thank the lab and my PI for allowing me to do this study. Thank you and have a good day.